Fecal incontinence is a devastating problem. We are very proud of the results that we achieve with our bowel management program when during a one-week period, by trial and error, we design a specific enema that, given once a day, keep the patient artificially clean of stool in the underwear. We would like to share with you what we call the ABCDE for the treatment of fecal incontinence. A stands for addressing the prognosis for bowel control. Is this patient truly fecal incontinent? Patients that are fecally incontinent are the ones born with an anorectal malformation that has a sacral ratio of less than 0.4, patients with sacral agenesis, myelomeningocele, or the ones with a history of a large sacrococcygeal teratoma. B is the bowel characteristic on the contrast enema. Does this patient have a dilated bowel, or does this patient have a non-dilated bowel? Patients with a dilated colon will need a very large and concentrated enemas, and patients with a non-dilated colon will need a small volume enema and sometimes loperamide. C is the component of the enema. We like to use as our base normal saline solution and as our irritants liquid glycerin, Castile soap, and phosphate. D stands for determining the amount of stool in the colon after the enema. We can do it by simply analyzing an abdominal radiograph to look for the stool after the enema. We are mainly concentrating in the rectum and the left colon that should be clean after receiving a proper enema. E stands for enema adjustments, and we do it based on the patient or the parent's report as well as what we see in the abdominal radiograph. For example, if a patient reports that he or she had multiple stool accidents and we look at the abdominal radiograph and we see significant amount of stool in the rectum or in the colon, it means that this patient needs a more concentrated enema. We keep adjusting the enema until we have a clean patient and a clean abdominal radiograph. Following these simple steps, we achieve a 95% success rate, but most importantly, we significantly improve the quality of life of our patients.